Hi, everyone. Welcome to the RightSleep Sleep Chats. This is a series of short videos featuring RightSleep creator Dr. Stasha Gominak, answering some of our frequently asked questions, as well as some that you may not have even thought of to ask. We'll tackle one question at a time to help you improve your sleep and ultimately improve your health. So, Stasha, today's question is it safe to do RightSleep on your own? Don't you need a doctor to monitor your progress?
I say this each time, but that's a great question. So there's a big change in how medicine is practiced. The internet has really changed the level of education that the lay public has access to. And that means that we as physicians have needed to pay attention to the fact that we are not the only smart ones in the room. So if you think of it historically, really you had to be in a different social class, an educated social class in Great Britain to become a physician. We have dragged these class designations into medicine, in my view, so that doctors have become or have been trained to be very arrogant about what they know about. And when you drag that into a time when everyone can read the same scientific articles that I can read, that's inappropriate, especially since COVID. So there's an important change when we were able to talk directly to people on video, that the physicians started to teach more. And that's what I want to do. So that's a little bit to the side of the actual question. But the reason why that question is so appropriate for RightSleep program itself is because the RightSleep program is completely resting on your observations of what happens to your body when you change these vitamins. So I'm not there living in your house with you, asking you how you feel. I'm insisting that you must make frequent observation about what your body says. Because I had been doing this program with my own patients as a neurologist, and I began to realize that there were no blood levels, aside from the vitamin D level and the B12, there were no blood levels of any of the Bs that were reliable, that had anything to do with what we were going to do about moving the vitamins around. That's very confusing for me. That's not the way I was used to practicing. Even the vitamin D level is not the whole story. There are episodes of things that happen when you move the D dose around rapidly that suggest that the brain will tell you if it's happy with this particular dose. If you double the dose, many times your brain will say, no, I didn't like that. That means RightSleep is really about changing the way you think about supplements, changing the way you think about the medicines we use, changing the way you think about who is supposed to be having the dialogue with these pills. It really should be you, the user, who's having the dialogue. And you may have a guide, that would be me, that tells you what other people have experienced. And that's what I try to do on the website and on the Q&As. But it really turns out that you, as the user of these supplements, has to be willing to say, well, I just started the B vitamins and I felt agitated and out of sorts. And what does that mean? That is really the core of how to do these vitamin supplements safely and how to recognize when it's time not to use them anymore. That means there's a big shift in how we think of ourselves in relationship to our doctor and these supplements. So the short answer is yes, it is safe for you to do this program by yourself if you have a guide, and that's what the workbook is. Many times there are details or nuances about the things that you'll want to know that'll be addressed on the Q&As. Many times you will have questions that you want to address with the Facebook group, and that's why we have those supports there for you.
That's great. It's like the the internet has brought us all closer together so that we can have these supports in place. And those supports that Stasha mentioned go along with the whole RightSleep program, which you can find at drgominak.com.